What's going on, everyone? Happy Friday. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, flu test, RSV, norovirus, maybe a pneumonia or something else, I hope you have tested negative. If you're feeling sick or tested positive for any of these viruses, I hope you have a full and speedy recovery with no long-term and no long COVID issues. It is time now for the Friday edition of the Virus Update for Friday, December 27th, 2024. If you're new to my channel, welcome to my channel. This is where I do the virus update as needed, although as of lately it's been becoming daily once again. And if you want to stay informed with what's going on with all these viruses, COVID, flu, influenza, everything, because there's a lot of people sick right now. Maybe you clicked on this video because you're sick. If you did just that, let me know down below. Want to stay informed? Just subscribe down below. Share this video with anyone you know. Give this video a thumbs up. The more people that hit that like button, the more YouTube is going to push this content throughout the algorithm. Of course, hit that notification bell. And of course, leave all comments down below. Alright, one of the big things we do around here is give you the news of the day on all the viruses out there or any new studies. So we're going to do that today, and we do have several things to share today. Then we're going to take a look at some daily data, some EMS data, some new data from the CDC, and wastewater data as well. Then we're going to take a look at New York State and Colorado. We do have Colorado today, and we do have data from CJS, some numbers to run by, quite a few. We have several days worth of data, so stick around for all of that. Starting off today, COVID pregnancies may have boosted autism risk, UCLA study shows, and this does go back into the early days of the pandemic, as far back as 2020. So basically, if you were pregnant and you had COVID at the same time, well, that does boost the risk of autism in that child. Yes, unfortunately, that is a thing. You want to read this full study and anything that I post today, either some point tonight or tomorrow morning, I do post a thread over on my website, datareport.info, on all the stories and stuff that you see here, and any studies do make it into the archives of my website. Because sometimes we just read headlines, and maybe you're like, well, I wish we would have read the full story. Well, you can do that. If I sat here and read every full story from each news story each day, my videos would go over an hour. No one wants to sit through an hour. As is lately, we have had a few that have gone over 30 minutes. Never used to do that, but that's where we're at this point. All right, so this will make it to my website, probably in multiple ways. Thread and archives. Virus in Louisiana bird flu patient shows mutations that could increase transmissibility. And in this case, we will read the first paragraph. So you need to know about this. A genetic analysis of samples from the patient in Louisiana recently hospitalized with the country's first severe case of H5N1 bird flu show the virus likely mutated in the patient to become potentially more transmissible to humans. That's a key point, but here's another key point. But there's no evidence the virus has been passed to anyone else. So still no human-to-human transmission, but we just found that a human who's hospitalized, the virus was able to mutate within that one person. That's a very bad thing. Number one, it can mutate faster, and number two, if it ever, God forbid, went human to human, it would transmit faster. Not a good thing whatsoever. All right, Gypsy, we talked about this the other day. It's a show on Broadway. Gypsy Broadway show canceled again due to continued illness. People on the production staff or people within the performers are dealing with illness right now. So, yes, this is an ongoing problem, and it's that time of year. All right. Moving on to this. Flu intensifies in France. COVID-19 stable, the latest official figures show. And there has been a significant increase this year in this week's update in admissions, hospital admissions among those age 65 and over. But it's hitting children at the ages of 15. And children are getting hit hard. And you can see here, it is quickly going up for a number of cases. But take a look here at COVID. COVID is not going up. COVID is flat. Flu is going up. And it's tracking with some of these other years that have been pretty bad. All right, here's one that's interesting. This was tweeted out by Kate Pritchard. Apparently, COVID-19 can cause hearing loss issues. Yes, symptomatic COVID-19 patients had significant involvement of the inner ears compared to asymptomatic patients. So, if you did have a symptomatic case, it could cause ear issues, hearing. And I'm hearing a lot of people that are having problems with ringing in the ears. That is a real issue. All right, New Hampshire. And by the way, that study as well will make it to the archives. I might have already put it there. I put a few in this morning. And I'm going to be adding a few almost every day. All right, in New Hampshire, they are seeing an increase in the number of whooping cough cases. And trends go back to pre-pandemic levels. So, yeah, whooping coughing. It's otherwise known as pertussis. It is going up in New Hampshire. It's been going up everywhere. And it does say here, doctors across the country are reporting spikes in whooping cough cases this year with figures at a 10-year high. So this is not good. All right, Central Virginia sees surge in respiratory illnesses. These viruses are to blame. So let's see what the viruses are. Central Virginia is currently experiencing a high number of emergency room visits due to respiratory illnesses, according to data from the Virginia Department of Health. In fact, it is the only region in the Commonwealth reporting such an increase. The Virginia Department of Health states that 20% of all hospital visits in the region are for respiratory illnesses. Children 4 years old and younger are particularly affected, as they seem to be admitted to the hospitals the most frequently across Virginia. That's rather concerning. Children 4 and younger, there could be many reasons. Number one, maybe they had COVID and it impacted their immune system, or maybe they didn't have their vaccines. Yeah, it's not good, and I think someone ought to be looking into why is this happening. And I think the result that they're probably going to get is children not being vaccinated properly. And take a look at this. We're seeing cases or causes outside of flu, COVID-19, and RSV leading to those hospitalizations, leading to that pneumonia. Yeah, pneumonia is increasing in the community as well, and they're seeing rises and increases in COVID-19 and flu infections. So yeah, things are really picking up in Central Virginia. And we've been seeing it in Virginia as a whole. When we go to their dashboard, can we pull that up real quickly? I believe I can. I don't know if I have updated this. No, it's not going to update again until next week. But the point is, here it is. I want to show you this right here. Ages 0 through 4. Take a look at that. And you can see here, those ages are really being impacted, and they are really making up a large sum of emergency department visits. That is not a good thing to see. And if that's happening in Virginia, I wonder what is going on in other states at this time. All right, wanted to share this with you. A user on my site and a regular commenter here on my video did add this, and I thank you so much. They posted this in a comment on one of the threads on my site. And check this out. It is COVID-safe providers. Now, a word of caution. I don't know how up to date all these providers are on the list. You know, some of them could have been added a couple years ago, and maybe they're no longer taking precautions. But the point is, you can go to this site, and there's probably a couple other sites out there. You can go to this site and check your area. So let's do that. I'll just go to my area for the heck of it. And when you can click on places that are, you know, still taking COVID precautions at doctor's offices. I'm seeing dentists. I'm seeing telehealth. I'm seeing things where, you know, they still take precautions for COVID. And take a look at this. Up in Willow Grove, Pennsylvania, Dr. J. Friedman is coming up here, DDS, and he is being recommended to be a COVID-safe dentist. That's fantastic. Look at this. Acupuncture. Heather McGinnis and the Wave Acupuncture, a COVID-safe facility. And I did see someone posted a comment on X, because I shared this on X as well. I believe it was in Montclair, New Jersey. Yes, Ferguson Dental, I believe that was. They confirmed that dentist does take things seriously. There were air purifiers in every room. They were masking. They would do anything to accommodate, to keep people safe. So check out this website. See if there's anything near you. Of course, there's not going to be COVID-safe places everywhere. Check it out. See if it's still accurate. Does it still exist for COVID safe places in your area? And if it does, hey, check into it. Maybe it is a good option. Fantastic website. I am going to put this link to this website in the description of today's video. Also, it will make today's thread. And do you ever want to see the threads that I do for all the news stories with the links to the stories? DataReport.info is my website. You come down here to virus update news stories and data sources. I don't always do it for every video. As of lately, I've been trying to do it for the majority of the videos. And we did yesterday. Here's yesterday's, December 26th. I posted it this morning. Here's all the links to the different stories that were in yesterday's videos. And surprisingly, some of these are starting to get viewed. December 13th virus update. 123 people clicked on that. December 11th, 170 people checked that out. So, yes, it does actually get viewed. I think it is a useful resource. Something else that's a useful resource, COVID studies and papers, COVID positive archive. We're actually going to be doing a special video. I don't know if it's going to be Sunday or New Year's Eve, but we're actually going to go do a little review of the year, of all the things that happened this year. Famous people that tested positive. Some of the key studies that have been released this year. Some of the things that have happened over the year. We're going to just do a look back over on the things that happened this year, such as who remembers that awful summer wave of COVID. All those different things. We'll look back on that maybe on Sunday. We haven't been doing Sunday videos lately, although we did do one last Sunday, so maybe Sunday that is what we will do this week if it is a slow news day. Alright, the viral activity level in Canada. I already did refresh this. Let's refresh it again. COVID-19 is moderate. Flu A is now moderate. Flu B is low. RSV is listed high at this time. UK, no update for you until next week. Hopefully we can view purple air today. I've been having trouble getting this loading. It's been coming up grayed out for me. There we go. The West Coast, a few problem spots. Great Lakes to the east, all the way down to Georgia. Some bad air qualities there. Do you want to learn more about climate and the weather, more so the weather? I do have another place where I talk about that. It is Climate Data Report. I did post a video there. I'm expecting a significant severe weather outbreak tomorrow in the southeast. Some of that will carry over into Sunday. Go check that channel out. We already posted today's video there. And as you can see, it's already gaining some attention because this could be a significant outbreak. It's something that can happen in the winter months. Yes, there can be tornadoes, wind, and hail, even in the winter time. Of course, hail being a frozen precipitation. All right, Philadelphia yesterday, slight increase in EMS calls, 780. It is below 800. That is some good news. And let's do a live look in at Montgomery County, Pennsylvania. 11 EMS calls right now. Respiratory emergency is showing up, and some other things as well. Hopefully, Chester County is a lot better than what I saw earlier. There were 17 calls in Chester County earlier. Less calls, but seeing heart problems here a couple times. Respiratory difficulty. Matter of fact, I think, is that heart problems 3 times? Yep. Sick person. So there are some calls to be had. I've been listening to Center County, Pennsylvania. It's been getting busier there. I can actually go on radio reference, and I can go back and hear the whole day's worth of transmissions. That may sound silly to you, but I do like to take note of how many flu, COVID, and respiratory illnesses I do hear, and I'm a few days behind, but I'm slowly catching up in the evening. I spend a little bit of time each evening catching up and starting to hear the C word a couple times and starting to hear other things such as fever and whatnot pop up. So that's the deal with Pennsylvania. Taking a look at what's going on with the hospital situation in Pennsylvania. We can see here, we are seeing several yellows pop up. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13 hospitals showing up yellow. That can be for many things. That can be various different diversions. That can be a behavioral health. Or that could mean the emergency room is just overwhelmed to begin with. And take a look at this. Here's something I don't see too often. This looks like it is Taylor Hospital. Yes, Taylor Hospital. A stroke diversion. Now, I'm honestly not 100% certain where that is. It may be in south central Pennsylvania. St. Luke's Warren campus emergency department is overcrowding at this time. And we are seeing Waynesboro. Take a look at this one. Emergency department divert at WellSpan Waynesboro. That is not a good thing. And Up in Reading, Pennsylvania, behavioral health diversion. So yes, we're seeing a lot of different things going on here. This is not a good thing to see all these different hospitals having a problem. And take a look at this. Wow, Lincoln All Medical Center. This is a big one in the Philadelphia area. It is seeing a diversion at this time, but it is still open to trauma, CVA, STEMI, and OB at this time. So some problems with the hospitals in eastern Pennsylvania, mainly eastern Pennsylvania, New Jersey. Take a look at this. Everything is normal today. That is fantastic news. I still don't think we had an update on wastewater in Pennsylvania. Let's see, did we? No, we are still seeing Lehigh County come in at an increase for COVID, a decrease in Montgomery County, Pennsylvania, a large increase in Chester County, Pennsylvania. We're seeing an increase in York County, Franklin County, and also an increase in portions of Allegheny County. Everywhere else is stable or insufficient data at this time. Walgreens, the COVID positivity rate is 15.5% this week. That was up by 0.3%. All right, let's take a look at 3 wastewater sites today, shall we? And we just spent a lot of time talking about the East, or at least Pennsylvania, for a little bit. Let's take a look at what is going on in California, shall we? And let's go to somewhere we don't use it. How about this one right here? Turlock, California. I want to do somewhere different out here today. Hey, 86,000 population. This is a populated area. Honestly, I didn't know this wastewater site was so big. COVID at this time, it's still low. It has actually dropped a little bit. RSV did get high. Still says high, but it's dropping right now. Influenza A, wow. That is a really high level detected, and it's remaining high. Norovirus at this time is still high. Mpox is low. EVD68 is high and rising at this time, and everything else is not much of an issue at this wastewater site. All right, let's continue to the east. I wish WastewaterSCAN would put some Arizona and New Mexico sites on there. It is totally ridiculous that they don't have anything there. Let's see what's going on in Dallas. Can we sometimes? This is a problem. All right, we can take a look at COVID, and COVID's not calculated. Nothing's calculated here, but it is starting to rise. RSV not calculated, but rising. Influenza A is really low. Influenza B, actually, hold on here. Influenza A, they have this map zoomed out. But yes, it is still low, but it is starting to rise. Influenza B is low. HMPV is low. Norovirus, if calculated, probably would come up as medium. Mpox, look at this. There was a detection of that on December 13th. And I got to remember to search Mpox during my searches. We haven't talked about that in news stories in a while. There could be something out there. I failed to search that one. EVD68 is low, and there are some detections of hepatitis at this time. All right, one more wastewater site, and this time we will come to the east. We'll come at least a little bit further to the east. How about we go down to Delaware? What's going on in Seaford, Delaware? I'm seeing RSV listed high, and that has been rising. COVID is starting to rise. Influenza A is low. Influenza B is low. HMPV is low but rising. Norovirus is very high at this time. Mpox is low. EVD68 is low. And everything else is not an issue at this time. All right, some new data from the CDC. Epidemic status for COVID is either growing or likely growing across much of the country. It's not changing in Florida, Georgia, Alabama. It's not changing in North Carolina, and not changing in New Jersey or Vermont, which is a surprise. More so a surprise about New Jersey. Delaware, it's not changing. Indiana, it's not changing. Alaska is likely declining at this time. Good news there. They were one of the early states to start rising, but again, you shouldn't expect a big wave there because they got hit so hard in the summertime, but they did at least have something, some sort of a wave there. And Hawaii is not changing at this time. Now, when we come down to flu, it's growing or likely growing across the entire country with exceptions to not changing in Florida, Alabama, and looks like there may be no data at all in Arkansas, Missouri, Wyoming, and also Oregon as well. And even in Alaska and Hawaii, things are growing or likely growing at this time. The latest variant of COVID is the XEC variant, which is at 45%. KP 3.1.1 is at 24%. LP.8.1 is at 8%. MC.1 is 5%. LF.7 is 4%. This did not update this week. This came in last week. All right. The influenza-like illness activity levels. They are exploding in many places now, and we do even have highest level shades, very high, showing up in Louisiana and Oregon at this time. We also have just below that now showing up for Tennessee and Alabama. Yes, things are getting worse there, and we still have very high in other places as well. Mississippi, New Mexico, California has now skyrocketed to very high. So while you're not doing too bad with COVID, everything else is going bad in California at this time. It looks like we also have Idaho showing up on that, and New York City. And then we do have high levels showing up in a whole bunch of different places, and we do now have added more places to moderate. Wisconsin's now coming in at moderate, and there still are some places that are listed at low at this time as well. Pennsylvania is still low. Michigan's still low, and Puerto Rico is still low. Sometimes Puerto Rico does not have their wave until the second half of winter. We saw that happen about a year ago, I think, if I remember correctly. Hospital bed capacity as of December 21st, 75.4% of beds are being used across the United States. We're not going to do any individual lookings today because we do have a lot more things to get through. Taking a look at what's going on with emergency department visits, they continue to rise at this time, and they're starting to pick up the pace. But key notes here, they are not as high as previous years. I don't think they will get as high as the summer peak because COVID overall will peak in the next couple of weeks. So we'll have to see what happens there. Taking a look at what's going on with the CDC wastewater map, I've been refreshing this, and I don't think it's updated as of yet. I'll refresh it again later. And if it does update, I will get that to you in tomorrow's video. All right, 756 people tested positive in the state of New York, and also their hospital level at this time is 613 with 56 patients in the ICU. All right, quickly taking a look at Colorado, and the number of people in the hospital for COVID is down by 26. That's 113. Influenza, 119. That's up by 37. RSV, 104. That's up by 28. And we do have some bad news. Emergency department visits for COVID, 1.5%. Influenza is now up to 2.43%. RSV is up to this, not even 0.25%. But here's where it gets interesting. COVID positivity rate is down to 7.22%. Influenza positivity rate has exploded to 14.07%. That is up by 6.37%. RSV is 6.23%. That is up by 2.39%. I wish states, when you're doing testing for influenza, and I get it, it could be expensive, I wish all influenza testing right now would take the extra step and check for bird flu. I know, I just said that. But it should be. I mean, how many are bird flu and don't even realize it? It could be out there. We don't know. We really need to ramp up surveillance for that. All right, let's take a look at some data from CJS here, and we do have quite a bit of data. This is 3 days worth. But before we get to that, I do have here, if you have tested positive for COVID, now chances are you will have to miss out on New Year's Eve. Yes, that is an ongoing issue. Yep, New Year's Eve is coming up. We wish everyone a happy and healthy New Year, but if you want to do celebrations, you got to be negative for these viruses, COVID, all of them, because you could have someone who's high risk attending your event. Have you noticed more sick announcements or posts on social media? If you have, let me know down below. All right, now that data from CJS, I'm going to try and run through this quickly. Apologies for talking fast. This video is running long today. Christmas Eve in Florida, daily 619 new cases. New Jersey, weekday 671 new cases and 1 new death. New York, daily 651 new cases. Puerto Rico, daily 144 new cases and 3 new deaths. Maryland, weekly 928 new cases, the highest weekly count in about 2 to 3 months, and 10 new deaths. Maine, weekly 502 new cases. North Dakota, weekly 443 new cases and 4 new deaths reported to the CDC data tracker this past Friday. Christmas Day, Florida, daily 362 new cases and 7 new deaths. New York, daily 666 new cases. Arizona, weekly 2,255 new cases and 25 new deaths. Nevada, weekly, 374 new cases. And then on Thursday, Florida, daily, 234 new cases and 2 new deaths. New Jersey, weekday, 623 new cases and 1 new death. New Jersey's is a 2-day update, and I suspect some of these could be lags, so we may see things come in higher next week. Like, for example, New York State, that could be some lag today. We saw that number that's lower. We may see a data dump next week from many different places, and that could include deaths as well. New York daily, 1,202 new cases. That was yesterday, not today's number. Colorado, weekly, 347 new positive tests, a test case positivity rate of 7.2% this week, and 2 CDC reported deaths. Connecticut, weekly, whoa, this seems, yeah, it is high. 1,891 new cases, 14 CDC reported deaths. Connecticut is a 2-week update. Kentucky, weekly, 1,822 new positive tests and 12 CDC reported deaths. Massachusetts, weekly, 2,139 new cases and 13 new deaths. Michigan, weekly but delayed 2 days, 3,590 new cases and 24 new deaths. Minnesota, weekly, 2,471 new cases and 3 new deaths. New Mexico, weekly, 1,182 new cases and 6 CDC reported deaths. Ohio, as I mentioned yesterday at the end of the video, weekly, 5,555 new cases and 14 state reported deaths. The CDC provisional count shows 23 new deaths. Oregon, weekly, 12 new deaths. Apparently no new testing data for this week. South Dakota, weekly, 661 new deaths. 661 new cases, not deaths. That would be a really bad death number, wouldn't it? Luckily, that's only cases, but not good to see 661 cases either. Tennessee, weekly, 2,028 new cases. Washington, weekly, 293 new emergency department visits and 12 new deaths. Alrighty, we covered a ton today. Here we are. We're almost at 30 minutes on this video. That does it for the Friday edition of the virus update. There will be a Saturday edition this week because it's only 2:51 in the afternoon. I'm sure I'm going to find stories, and I'm leaning towards Sunday. I'm going to start working on it tonight and tomorrow on a year in review. We'll go back and talk about all the big stories, the big outbreaks, different things that happen throughout the year. I don't know if it's going to be a long video, but I think it'll be interesting to look back on what occurred over this past year. If you enjoyed this video, give it a thumbs up. The more people that do that, the more YouTube's going to push out this content. Share this video with anyone you know. Subscribe down below. Leave your comments down below. And of course, remember to hit that notification. I will see you all again tomorrow. Until I see you again tomorrow, stay safe and thanks for watching and have a fantastic Friday evening. Bye-bye for now.